Today, we'll discuss the types, indications of IV fluids. IV fluids are sterile solutions administered directly into a patient's vein to restore fluid and electrolyte balance, deliver nutrients, and provide a vehicle for medications. To fully understand the essential nature of IV fluids, it's critical to comprehend the different types, their specific effects on the body, the conditions they treat, and the risks of incorrect use. The two main categories of intravenous, IV fluids, are crystalloids and colloids. Crystalloids such as saline and lactated ringers easily pass through blood vessel walls, hydrating tissues effectively, while colloids like albumin contain larger molecules that remain longer in the bloodstream to expand blood volume. IV fluids are used in various clinical situations, including dehydration, shock, surgery, and electrolyte imbalances. Choosing the right type depends on patient condition and fluid requirements. Based on their tonicity, crystalloid IV fluids are categorized into isotonic, hypotonic, and hypertonic solutions. Each type has a specific effect on the body's fluid balance and is used to treat different medical conditions. First we have a hypertonic solution has a lower concentration of solutes than blood plasma, which causes water to shift from the bloodstream into the body's cells to balance the concentration. Hypertonic fluids are used to treat conditions that cause cellular dehydration, such as hyponatremia, high sodium levels, and diabetic ketoacidosis. One type of hypertonic fluids is 0.45% sodium chloride, half normal saline, a common hypertonic fluid used to treat conditions like hypernatremia. Although initially isotonic, the body quickly metabolizes the dextrose, leaving behind free water. This makes D5W functionally hypertonic and a poor choice for fluid resuscitation. Next is the isotonic solutions, which are used to maintain fluid balance as they have a similar concentration of solutes as blood. They do not cause significant fluid shifts between compartments. Isotonic fluids are used to treat conditions involving fluid volume loss, such as dehydration, hypovolemia, and hypovolemic shock caused by severe vomiting, diarrhea, or hemorrhage. The types of isotonic IV fluids include normal saline, 0.9% NaCl, a mixture of salt and sterile water used for hydration and fluid resuscitation during conditions like hemorrhage, vomiting, or shock. Lactated ringers contains sodium, chloride, potassium, and calcium. It is often used for burn and trauma patients because its composition is similar to blood plasma. Dextrose 5% in water, D5W, provides some sugar for energy and is used to treat hypernatremia. It is considered isotonic in the bag but becomes hypotonic in the body as the cells absorb the dextrose. Next is the hypertonic solutions, which have a higher concentration of solutes, which pulls fluid from the cells into the bloodstream. They are used for specific critical conditions. Hypertonic IV fluids are used to treat medical conditions where there is a need to draw excess fluid out of cells and into the bloodstream. Conditions such as severe hyponatremia, cerebral edema, hypovolemic shock, fluid overload, and ketosis of starvation. One example of the hypertonic IV fluids is the 3% or 5% saline, used to treat severe hyponatremia, low sodium, and reduce cerebral edema. Now we discuss what is colloid IV fluids and types. Colloids contain larger molecules, such as proteins, which stay in the bloodstream for a longer period of time and help increase blood volume and pressure. Albumin, a natural protein used in patients with severe infections, burns, or liver disease. Another type is dextran, a synthetic solution used for volume expansion during shock or hemorrhage. In summary, we've covered the different types of IV fluids, crystalloids and colloids, and the critical importance of selecting the right one for the patient's condition. Remember that monitoring for fluid overload and managing electrolyte balance are key responsibilities. Mastering these principles allows us to provide safe and effective IV therapy. With our understanding of IV fluid therapy refreshed, let's test our critical thinking skills. Here are a few NCLEX-style questions that will challenge us to think like a nurse at the bedside. First scenario. A client with adrenal insufficiency is hypotensive and dizzy. The provider orders a fluid bolus. Which of the following isotonic solutions should the nurse anticipate administering? A. 0.45% normal saline. B. 5% dextrose in water. D5W. C. Lactated ringers. D. 3% sodium chloride. And the correct answer is C. Lactated ringers. Isotonic solutions like lactated ringers are the initial fluid of choice for hypovolemic patients with low blood pressure and dizziness, as they rapidly expand the intravascular volume. Next scenario. The nurse is caring for a patient with a sodium level of 120 milliequivalents per liter, who is experiencing confusion, seizures, and muscle cramps. The nurse should anticipate an order for which type of IV fluid? A. Isotonic fluid, such as 0.9%, normal saline. B. Hypotonic fluid, such as 0.45%, normal saline. C. Hypertonic fluid, such as 3%, sodium chloride. D. Colloid solution, such as albumin. The correct answer is C. Hypertonic fluid, such as 3% sodium chloride. The patient's low sodium level, hyponatremia, with neurological symptoms, requires a rapid increase in serum sodium. Hypertonic solutions like 3% sodium chloride pull fluid from the cells back into the blood vessels to correct the imbalance. This is a critical care intervention. The next scenario. The nurse is administering IV fluids to an elderly patient at 150 milliliters per hour. Which assessment finding would indicate the patient is experiencing fluid volume overload? A. Orthostatic hypotension. B. Flat neck veins. C. Bounding pulses. D. Dry mucous membranes. The correct answer is C. Bounding pulses. Fluid volume overload, hypervolemia, leads to an increased intravascular volume, which manifests as bounding or full pulses. Other signs include increased blood pressure, crackles in the lungs, and jugular venous distension, JVD. Next, a nurse notes that a client receiving IV fluids has edema, cool skin, and pain at the IV insertion site. What is the nurse's priority action? A. Slow the rate of the infusion. B. Discontinue the IV and elevate the extremity. C. Apply a warm compress to the area. D. Check the client's vital signs. The answer is B. Discontinue the IV and elevate the extremity. The described symptoms are classic signs of infiltration, where the IV fluid has leaked into the surrounding tissue. The priority intervention is to stop the fluid and remove the source of the infiltration. Elevating the extremity can help reduce swelling. Despite their benefits, IV fluids are like any other drug and can lead to complications such as fluid overload or electrolyte disturbances if not monitored carefully. Hope you learned something about IV fluids. Please hit like and subscribe to support the page.